Good day teaching everyone. My name is Kimberly Detalo from Bachelor of Secondary Education, major in Filipino. My topic is all about HIV and AIDS infection. But let me define first what is HIV infections, then the following is how HIV transmitted through bodily, then the second is the specific behaviors that spread HIV, then the third is symptoms of HIV infection, then the treatment and also how to prevent HIV. Then after that, I will discuss the AIDS infection. Also, I will define what each AIDS infection. Then the second is diagnose or symptom of AIDS, then also the treatment. HIV or human immunodeficiency virus. What is HIV? It destroys the immune system, which makes it possible for the body to fight off disease or even minor illnesses. A person is said to be HIV positive if antibodies to the virus are detected in his or her blood. It may take up to 6 months after infection for antibodies to appear. Someone who is HIV positive may appear to be healthy for 10 years or longer before symptom of age develops. HIV is not spread by getting bitten mosquitoes, from toilet seats, being caught by an infected person, or who have casual contacts with someone who has HIV positive or has AIDS. In the term HIV stands for Human Immunodeficiency Virus. The name describes the virus. Only human can contract it, and it attacks the immune system. As a result, the immune system is unable to work as effectively as it should. And now, let's proceed to the 4 types of HIV infections that transmitted through bodily. First is blood. Second is semen. Third is vaginal and rectal fluids. Then the last is breast milk. After the HIV is transmitted, let's proceed to the specific behaviors that spread HIV. Is sharing injection needles and syringe with someone who is HIV positive. Second, unprotected or without a condom rectal intercourse with someone who is HIV positive, or you can call it anal sex. Third, unprotected vaginal or oral sexual activity with someone who is HIV positive. Then the last is babies born to breastfeed by women who is HIV positive are also at risk on contracting the virus. After the HIV is transmitted, let's proceed to the specific behaviors that spread HIV. The early symptoms of HIV infections are like the symptoms that won't go away. The common symptoms are rapid unexplained weight loss, persistent unexplained fever and night sweats, persistent diarrhea, persistent severe fatigue, swelling of glands in neck, armpits or groin, and as the immune system deteriorates, a variety of other symptoms may appear, like unusual sores of the skin, in the mouth, white patches in the mouth, increased outbreaks of cold sores, unexplained shortness of breath and dry cough, severe numbness or pain in the hands and feet, and lastly, unusual cancer and infections. And now, I'll discuss how to treatment the HIV infections. Medical care including treatment called antiretroviral therapy. It is possible to manage HIV and live with the virus for many years. Without treatment, a person with HIV is likely to develop a serious condition called acquired immunodeficiency syndrome, known as AIDS. After the treatment, let's proceed to the last, which is the prevention of HIV infections. If you are beginning a sexual relationship, take time before having sex talk about HIV and other STDs. Find out if your partner has been exposed to or infected by STDs, or if your partner's behavior puts him or her at risk for HIV infection. Remember that it is possible to be infected without knowing it. So after I'll discuss the prevention of HIV infections, let's proceed to AIDS, or we can call it AIDS infection or diseases. So what is AIDS? Which is short for acquired immunodeficiency syndrome.
is a condition. Contracting HIV can lead to develop of AIDS. The diagnosis of AIDS is way of describing a whole group of symptoms and disease associated with the damaged HIV. Thus, O, which is short for acquired immunodeficiency syndrome, is a condition. Contracting HIV can lead to develop of AIDS. The diagnosis of AIDS is way of describing a whole group of symptoms and disease associated with the damage HIV does to the immune system. If an untreated HIV infection progresses, there is ongoing damage to immune defense cells. As this happens, the body becomes increasingly less able to fight off infections. When the immune system is made less effective in this way, a person is considered to have an acquired immune deficiency. That's the origin of term AIDS. Now, let's proceed to the 5 diagnoses or symptoms of AIDS infection. First is candidiasis or yeast infection of the throat and lungs. Second, invasive cervical cancer. Third, fungal infection caused by cryptococcus or coccidiosis. Fourth, HIV-related brain infections. Then the last is Kaposi's sarcoma. So after I'll discuss the symptoms or diagnosis of AIDS, let's proceed to the treatment. Untreated HIV can progress within a decade. There's currently no cure for AIDS and without treatment. Life expectancy after diagnosis is about 3 years. This may be a shorter period of person to develop severe opportunistic illness. However, treatment with antiretroviral drugs can prevent AIDS from developing. If AIDS does develop, it means the immune system is severely compromised. That untreated HIV can progress to AIDS within a decade. There's currently no cure for AIDS and without treatment. Life expectancy or untreated HIV can progress to AIDS within a decade. There's currently no cure for AIDS and without treatment. Life expectancy after diagnosis is about 3 years. This may be shorter if the person develops a severe opportunistic illness. Untreated HIV can progress to AIDS within a decade. There's currently no cure for AIDS and without treatment. Life expectancy Untreated HIV can progress to AIDS within a decade. There's currently no cure for AIDS and without treatment. Life expectancy after diagnosis is about 3 years. This may be shorter if the person develops a severe opportunistic illness. However, treatment with antiretroviral drugs can prevent AIDS from developing. If AIDS does develop, it means the immune system is severely compromised. That is weakened to the point where it can no longer successfully respond against disease and infections.